This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Filipinos are known to be happy people. That's why in a recent study, the Philippines was named as the third happiest among 5 countries in Asia, next to Singapore and Malaysia. But despite the Filipinos' happy disposition, the Philippines has had the highest incidence of depression in Southeast Asia with over 4.5 million reported cases.
So depression is highly treatable. So it's a mood disorder.
No doubt that depression is a serious case. It is important that we understand individuals who suffer from this condition.
Ang mga depressive thoughts ay mga ganito ang takbo. Ako ay walang kwenta, wala na akong silbi, wala nang nagmamahal sa akin, failure ako, nakakapag-isip na ano kaya ang pinakamadaling paraan para magpakamatay. That's when it becomes suicidal thoughts.
Individuals who suffer from depression also experience a downfall in their health.
Yung depression makes you more vulnerable to illness. Mas madali kang magkasakit, mas madali kang makaramdam ng pain. So yung sleep na di-disrupt, either sobrang tulog ng tulog or kulang sa tulog. And then yung appetite din, hindi na nakakakain, walang ganong kumain.
Why does depression lead to suicide? What are the signs to watch out for when one is suffering from depression? Are there medicines to cure this condition? How do we deal with an individual who goes through depression? All these and more tonight on MedTalk.
We always want to be happy and just spread good vibes to everyone. But we are not exempted from feeling blue at times. Tonight, we will tackle a medical condition called depression. Joining us in the discussion is Dr. Dina Nadera, psychiatrist and associate professor of the University of the Philippines, Open University. Also with us is Dr. Emma Lianto, pediatrician and adolescent medicine specialist from the Society of Adolescent Medicine of the Philippines, or SAMPI. You can participate in the discussion by calling our hotline, following us on Twitter. You can also post on our Facebook page or send us an email. Hi, doctors.
Hi, Angel.
Hi. Welcome to the show.
Thank you. Thanks for inviting us.
You know, feeling blue, feeling down and out is normal. But what happens when these feelings have progressed and are not normal anymore?
As was mentioned in the video earlier, it is actually a medical condition that affects your daily living. You lose your self-care, you have problems with your relationship, you have problems at work. That's when it becomes an illness. But we, as you said, we all go through.
Yes, there are all
through times of low times.
Yes, yes.
Yeah, this is especially a little problematic for teenagers because teenagers usually are more emotional. Yes. They deal with things in an emotional manner. And it's really normal for them to have mood swings. They're happy one moment, they're okay. And we have to understand also that this is a real illness.
Yes.
And a lot of these start during adolescence.
Yeah. Actually, yes, 20% of all mental illnesses, depression being one of them, start before the age of 14.
Wow.
So you have to catch it very early, so that you don't lose a lot of time curing it, because you have to prevent mental illness from really progressing.
You mentioned that it's more prevalent or more common in the adolescents, but you mentioned that there are mood swings.
Yeah, which are normal.
Yes, which is normal. So, which brings us to the question that is depression or this being normal, just sadness is just a manifestation of it?
Well, the usual. The usual is
well,
that.
the question is practically, when is sadness normal?
Yes.
Of course, we all go through low times. There are triggers that make us sad. But as I said, it becomes an illness if we start to forget that there are other things that are being affected, like work and studies. There are other people who are hurting because we are hurting. And then we start to indulge in pity, we start to think negative. So that's when it becomes serious, because we start losing a productive life. The quality of life is very low, and then you lose your economic productivity if you are working and
Or going to school.
Or going to school. So this now is the problem with depression. Many would say depression actually leads to suicide. But only 15% of those who undergo depression end up with this complication. Suicide is the worst complication of depression. But other than that, you see, depression is one of the mental illnesses that has a promising cure. It is highly treatable and it is highly preventable.
Okay.
With teenagers, the presentation could be a little different. The key would be persistent. So at least, I think the definition is 2 weeks persistently sad. I mean, you can be sad, but the next day you're okay.
What's a behavioral manifestation of someone who's 2 weeks persistently sad?
Well, I think there are different manifestations in terms of emotion, feeling, I think it was mentioned, hopeless, helpless, worthless. So these are the emotions that you're trapped and you can't get out. No? You're stuck there. And then behaviors, as mentioned, changes in mood, they isolate themselves, they don't eat as well, or they eat too much, they sleep too much. They lose pleasure in what they found pleasurable. So these are the things that, but in adolescence, unlike the adults who usually manifest with sadness, they can be irritable, they can be bored, they can be annoyed, they can abuse substances, and they can even be sexually promiscuous.
Yeah.
So they have a very different presentation. That's why sometimes you miss it.
Yeah, it's important, especially in adolescents, that depression may also present with vague physical problems, headache that doesn't go, weight loss.
I was about to ask about weight loss.
Yes, and then sometimes they have this gas pain. So there may be a lot of somatic presentations. So, and then the doctors who cannot point out what's wrong, and then this person comes back to you every so often with the same problem. They now think of depression also as a differential diagnosis.
Yeah, that's why you really have to ask the right questions.
Okay, and asking the right questions, we have a Facebook question.
Okay.
Doctors, when my wife gave birth to our first son, I noticed she became sad and anxious. Why did this happen?
Okay, there is such a thing as postpartum depression. So we can, of course, the first thing that comes to our mind is it's something that's related to the pregnancy and to giving birth. There has been a lot of studies pointing that mental health during the pregnancy period is actually a very important predictor of an outcome of pregnancy and birth. So there has to be a lot of psychological preparation, counseling before while the woman is pregnant and after giving birth. So this can be due to hormonal changes, and this can also be, as I said, the lack of a psychological preparation for this very important event. But all of us go through these times when there's a sudden hormone rush and we feel so up or we feel so down. So after some time, after a month or so, this depression should begin. Stop, especially if there's a very good family support.
So this is normal. Postpartum is normal. Do all mothers go through this?
I'm a pediatrician.
Postpartum blues, yes. But postpartum depression is actually a clinical condition already.
Okay, so postpartum blues is still normal, and the postpartum depression is already an illness.
Yes.
Okay.
I'm a pediatrician, so when they come in for the first week checkup for the baby, actually I'm also as interested in the mother and ask, how are you feeling? Are you getting enough rest? Getting support? Somebody's doing the household chores for you. How's your husband holding out, mga ganyan, no? So we give them tips on when the baby's sleeping, sleep ka rin, talk to your friends, do something on your own which is pleasurable for you. Then she comes back the next time, 1 week, 1 month later, she looks a little more ganyan. She's back to her makeup. And I know she's
nice.
okay.
Yeah.
Okay.
Yeah. But if she comes in still bedraggled,
Yeah, then that's very important to ask, no? Because you have to be very sure that the mother can actually give care to the child.
because if you're depressed, you can't
Yes.
bond
You can
yourself.
function.
Yes, you cannot
And
take
you
care
know
of
you
your
can
child.
actually abuse.
Yes.
Just child abuse.
There
can
have
be.
been stories of mothers who have who were going through not only the blues but
Depression.
which drove them to do things to themselves and to their children. We go back to maybe let's talk about the causes of depression, the different types. But we'll go to our Twitter question first, doctors. Can the weather really affect one's mood or make someone depressed? We were talking about this before we went on camera.
Yes. Probably the question is on seasonal affective disorder. A seasonal affective disorder is a very Western diagnosis.
It's a type of depression,
Yes,
no?
it's a type of depression,
You have too much sun.
especially yes.
That's why we're happy people.
In countries where there's long winter season and then there's not much sun, right? But in the Philippines, if we look at depression as an illness, we have not really done a study that tracks when it's highest. Because we have a very poor help-seeking behavior in terms of mental health and mental illness. But when we're talking about the complication, which is suicide, the data that we have at least is the highest is on summers.
Why is that?
We don't know yet.
Okay.
What I'm saying is the data that we have is during summers. The reports based on research. This is a 2-year research.
Okay.
We still need more data in order to see if there's really a pattern. But as I said, this is the complication of depression. This is not depression in general. So it's true that there is an effect. But we have yet to establish that in the Philippines because we don't have the weather that explains this illness in the weather in other countries.
Like when it's snowing,
Yes.
other people get depressed. Or maybe here during the rainy season when it's gloomy, when it's dark, memories
You feel
come back
down.
and your mood changes.
Yeah.
You just feel down.
You feel down, but tomorrow when the sun is up, you're happy.
You're happy again.
Or when the classes are suspended and the sun is up, you go out. Even if
It doesn't linger. This feeling doesn't linger.
Yes.
Doesn't persist.
It doesn't persist. Okay, one more question from Twitter, doctors. Can a good sleeping habit lessen the risk of depression?
Adolescents, would you like to
Well,
see? Before-
generally, you need sleep to be physically healthy. And of course, we have to understand that physical and mental health are intertwined and that we're getting back to the connectivity between physical health and mental health.
Yes.
Adolescents actually, paradoxically, need 8 to 9 hours of sleep, which is almost impossible at this time. So, connected in such a way because if you're depressed, you can't sleep. No? And then we also, when we counsel adolescents, we actually talk about sleep hygiene because that really improves the mood. No, I mean, if you're sleep deprived, you're cranky.
Yes,
and that actually
exactly.
sets you up for an even more difficult day.
Yeah.
So, good sleep actually is very helpful. No, well, it's not a treatment for depression.
It's actually the same for adults. One of the earlier signs of depression is impaired sleep. The impairment could either be under too little sleep or oversleeping. So yes, sleep hygiene is one of the things that you teach a person who is undergoing depression. And sometimes the medications that are given to a person who is depressed would also help this person go back to sleep, get a restful sleep.
So there are medications that one can take.
Depending
To help
on
them.
Yes, depending on the assessment, of course, of the psychiatrist or the specialist.
Okay, doctors, we will talk more about depression, the types, is it hereditary, and in what age, when MedTalk returns.
Did you know that Hollywood actor Jim Carrey suffered from depression? The comedy actor revealed his struggle with depression in 2004. He said that his inspiration for comedy is desperation. Carrey tried to make his sick mother laugh with his antics.
We're back here on MedTalk. Joining us now in the discussion is Arthur Nielsen de Mayen, Marketing and Resource Mobilization Officer of the Natasha Goldborn Foundation. Hi Arthur, welcome to the show.
Yeah, good evening. Thank you for having us. Yes.
Please tell us about the Natasha Goldborn Foundation, or NGF.
Yes. Well, the Natasha Goldborn Foundation was formed in 2007 with an aim to bring depression to light. Our vision is to promote a healthier society of Filipinos by focusing on doing preventive and positive activities that focus on the mental wellness for all. And basically, we're trying to combat the stigma that's associated with mental illnesses such as depression. We're making the public become more aware of this advocacy of ours, that it's okay to admit that you're depressed, because as what Dr. Nadera said, it's a highly preventable and treatable condition. So we're doing this through our various depression awareness campaigns and programs.
So when someone is going through a depression and someone tries to actually articulate it, it's not that they're just trying to vent. It's already a cry for help, and hence the foundation that helps all these individuals.
Yes, exactly. That's the reason why we have two programs. We're focusing on two programs at the moment. By July to September 2013, we're aiming to train teachers and guidance counselors so that they will be more equipped in detecting the early signs of depression among students across colleges and universities. And also, of course, the Hope Line. We've launched the Hope Line last September. It's been 7 months now since it has been launched. It's a 24/7 depression and suicide prevention crisis intervention center that provides assistance to those who are experiencing emotional crisis, are having thoughts of harming themselves, or having suicidal ideations. Yes, it's because depression knows no holidays. So again, it's open 24/7. Depression also doesn't choose its victims, so it's open for everyone. It doesn't matter how old or young you are, or how big or small your problems is. This Hope Line is for you. Just call us, and it's being manned by trained crisis hotline responders who underwent intensive training under the supervision of renowned mental health professionals in the country. And we're also using a manual to guide the responders in providing crisis intervention. Our goal is to refer these callers eventually to our partner doctors.
Our doctors,
Yes.
just like the doctors that we have here. You
Yes.
mentioned depression and suicide. Let's tackle that a little bit more. Depression and suicide, how does it lead to one harming themselves or one ending their life?
Actually, depression is one of the risk factors for suicide. When we say risk factors, it increases the probability that a person is going to exhibit suicidal behavior. We call it suicidal behavior. Depression is one of the mental illnesses, but we have to make it clear, just like what I said a while ago, that not all people who go through depression will end up in a suicide, will end up exhibiting suicide behavior. And not everyone exhibiting suicide behavior also have depression. So there are other risk factors. The reason why they are linked is because of the severity, actually, of depression.
So what are these factors? What are the manifestations, or what are the verbal, how do you call that, manifestations of one going through depression, which may lead to suicide?
Yeah. All the other signs and symptoms mentioned a while ago are actually signs of depression in general. But when a person starts to think of, plan, and actually attempt, a suicidal behavior, then that is when it's very, very severe. So when a person has depression, you will also think that there is a high chance that this person will end up exhibiting suicide behavior. So that's when you should really start treating depression.
You mentioned earlier in the discussion that there's a depression that lasts for two weeks, up to 2 years. So when does one determine if it's severe already within the time frame?
Actually, what I meant was the minimum time that you're going to to like look at the length of the symptoms is 2 weeks. But the depressive episode can last from 1 month to years. Okay, with or without treatment, 30% of those who undergo depression get well, and they're just so lucky that they don't go back to a depressed state.
Yes.
But most of them will have recurring symptoms. So that was the point of the discussion when we talk about but when it starts to become long and then there's no treatment, the longer it is, the more severe it is. And the presence of suicidality is an indication of severity.
Okay, this is one of the indications, suicide. Are there other indications, or from your experience with the Hope Line, what are the other concerns that individuals cry out for?
Well, great question. We've received calls from callers who were severely distressed because they recently broke up with their romantic relationships with other people. So relationship problems is the number one reason why they're calling, and also incidents of bullying and pressures, high expectations that they cannot fulfill.
So in educating, you mentioned there are programs to educate the teachers and the students as well. What about for families?
Right now, we used to conduct programs in providing assistance to the sons and daughters of OFWs because they're also prone to suffering from depression given that their parents are away. So that's also a part of our long-term plan. And when it comes to the schools, we recently received an approval from the Commission on Higher Education to hang tarpaulins in all major universities and colleges within the National Capital Region. And can I ask encourage for support for, of course, we cannot do this on our own. The Natasha Goldberg Foundation is a non-profit organization, so we're really calling for the support of big corporations, organizational entities, to adopt us into their corporate social responsibility initiatives. And we're also calling the public to engage, to volunteer, to make monthly contributions, and they can do that by visiting our website, www.ngf-hope.org. For our Twitter account, it's at NG Foundation PH, and for our Facebook, it's Natasha Goldberg Foundation.
Okay, so
The
very well connected.
Yes.
The education on general population is actually this show. We
very
are helping educate the public.
Yes.
The Natasha Goldberg Foundation, of course, any foundation will invest its money with a focused population, a special population. And if you have a very active PTA in schools,
exactly.
actually, you will be able to reach families also. That's why it is very important that they are reaching out to schools.
Yes. Yeah.
Because
I
reaching
agree.
one child is reaching an entire family.
That's right. And there's a certain stigma kasi that goes with talking about depression.
Yeah.
It's sort
Should
of
not be
taboo.
ashamed. Yeah.
People tend to be ashamed to talk about it, so it's done in silence. Like she's going through a depression. She mentioned harming herself, and
Yes.
and it stops there.
Yeah.
It's
It's probably because it's associated with mental illness. But as I was telling you a while ago,
Hindi naman kabaliwan
hindi naman,
yun eh.
yes. But
It's not insanity.
it's the same. It's the same as a heart ailment. How many heart
exactly.
conditions are there? It's the same as your blood vessels. You know how many problems with your bone marrow or your blood vessels are there? So it's the same with your brain. How many diagnoses of mental illness are there? There's a lot. So as I was saying, isang daan yung kabaliwan na diagnosis. And depression happens to be clustered among these mental
among
illnesses.
the 100.
Yes, among the hundreds. So that's why there's a stigma actually.
Yes, stigma.
And we
But,
have to get rid of, let's say, for the lack of a better
That's
word,
our
talagang just get rid of that
Oo.
stigma. But we cannot get rid of our Twitter question just yet. There's a question, Arthur, doctors, are there available medicines to take when someone is suffering from depression?
Yes, there are available medicines to take. That's why it is highly treatable. Depending on the severity of the depression and depending on the manifestation of your depression, the specialist, in this case, the psychiatrist, would prescribe whatever appropriate antidepressant is available. And depending also on the side effects, okay, of or the possible side effects. There's a side effect profile. So of course, the doctor will suggest a medication. But studies have shown that the best treatment is antidepressant or pharmacotherapy, we call it, plus psychotherapy.
Okay.
And then the second best is pharmacotherapy alone, and then the third best is psychotherapy alone. So it
it's a
should be
combination.
both. The best is the combination, pills and talk. The second is pills alone. The third is talk alone.
But sometimes others may not have access to the medication and may choose to forgo the medication because they will choose to just maybe keep it to themselves or talk to someone else.
That's true.
Will they still be able
Yeah.
to recover from this?
Oh, that's true, but it's
Yeah.
a difficult political question. Okay. But siguro what we tell the public is there are government hospitals, okay, that they can go to. General practitioners are actually trained to at least screen for mental health problems. Okay, I mean a very good general practitioner
Yes.
knows how to screen, and then there should be a good referral flow. So
Or
Yeah,
they can call
referral.
the Hope Line.
Yes.
they
Can I promote the
call
numbers?
Hope
Yeah.
Line.
Please do.
Yes, the 24/7 Hope Line is ready to assist you, especially if you're suffering from emotional crisis. The numbers to dial for landline is 804-4673 or 804-HOPE. For cell phone, it's 0917-558-4673. And we now have a toll-free number. For all Globe and Touch mobile subscribers nationwide, that's 2919. So we can all be bringers of hope. We can all banish someone else's darkness with our own light. So please feel free to call the Hope Line.
And aren't you also refer them to practitioners? Yes.
We refer them to our partner doctors so that they can receive professional help. Yes.
Yeah, on a general practitioner, pediatrician, doctor side, we actually, the Society of Adolescent Medicine of the Philippines, actually are teaching pediatricians how to ask the question, no? Because there's always a fear that if you ask the question, have you thought of hurting yourself? That
Kasi
is
they
going
get
to trigger.
defensive also
They
diba?
get no, but actually, most who are depressed and have thoughts of suicide actually welcome being asked and being. They want
Yes.
help.
It's a reassurance that it's okay to talk about it.
That it's a
And
valid
that's the first
complaint.
step, and
Yeah.
it's okay to talk about
and
it.
you won't be judged.
Yes.
Also,
Actually, at the Hope Line, most of them just need someone to talk to. Yes, they just need someone to talk to. They want someone to compassionately listen to them. Yeah.
Okay, and we will read our Facebook question now.
Okay.
Compassionately.
Yes.
Will someone who has gone through a depression go through it again? Can it recur?
Yes,
doctors?
yes. Depression is ranked as the 7th most burdensome disease. When we say burdensome disease, it has implications as to cost, quality of life, and the loss of employment opportunities. And the reason why is it is recurring, and it can be long lasting if it doesn't get treated properly.
it's like a chronic illness.
It's a chronic
like diabetes,
recurring
hypertension.
illness. Yes.
So,
And you know, we have a little laugh once in a while because it's okay to talk about it here in the discussion. No? It is an illness, it is something heavy, it is something to be addressed, but we can also think about it and hope
Yes, hope.
that through the foundation and through talks like this, people
think-
are
I
more
think
aware
the-
of
Aware.
how to deal with
Awareness.
it.
Yeah.
the message,
Oo.
I think, is we have to tell the public and those who are feeling depressed, there's help available.
Yes.
And there's
There are
hope.
options.
Actually, the statistics for getting better actually are very high, no? If you have the proper treatment. So there's hope.
Yeah,
That's
there's
actually-
hope.
that's the line that
and then
there's help.
the pills now are better than the pills before. I mean, in terms of the effectiveness and then the side effects, the side effect profile, the medications available over the counter, prescribed by the psychiatrists, are better and have less side effects.
And once they choose to take the medication and see a psychotherapist, they should follow it up. No?
Oh, yeah.
Should always follow it up. You just don't end there.
Yeah, especially with teenagers, you have to really monitor very closely because there are only a few of the tablets, the pills that are approved for teenagers.
Yes.
So you have to weigh the benefits and the risks for giving medications to a teenager.
And find a support group. Finding a support group is very important. So, you know, you just don't seek treatment in the hospital. There's also treatment available in the community.
Again, we can't emphasize enough. It's okay to talk about it.
Yes.
It really is okay. And, you know, that's all the time we have. I'd like to thank you, Doctors and Arthur.
Okay.
Yes.
I'd like to thank our guests for helping us understand depression. Once again, thank you to Dr. Dina Nadera and Dr. Emma Lianto and Arthur Demain. See you again next Tuesday on MedTalk as we talk about rabies. 10 p.m. on your scheduled on-air consultation here on the Solar News Channel. This is Angel Jacob. Good night.